All right, welcome back to the Trauma Therapist Podcast. My name is Guy McPherson. My mission is to raise the awareness of trauma and to support and inspire new trauma therapists just starting out on the trauma-informed journey. I do that with my membership community, Trauma Therapist 2.0, my online courses and workshops, and the Trauma Therapist newsletter. If you're a therapist of any kind and you work with individuals who've been impacted by trauma, I invite you to head on over to my website at thetraumatherapistproject.com. That's thetraumatherapistproject.com. All right, let's get started. You ready to do it?
Yep.
All right. I'll read your bio and then we'll dive in here.
Okay. Yeah.
All right. So 5, 4, 3, 2, and 1. All right, folks, welcome back to the Trauma Therapist Podcast. I am very excited to have as my guest today, Brock Chisolm. Brock, welcome.
Hi, Guy.
All right. Thanks so much for joining me today. So Brock is founder of Trauma Treatment International and a consultant clinical psychologist. He has over 15 years experience in the psychological assessment and treatment of trauma survivors and has assisted in the development and implementation of comprehensive services for trauma survivors internationally. In addition, Brock is also an advisory to several NGOs on self-care and prevention of burnout strategies for staff who work with traumatized populations. Awesome. Welcome.
Great.
So as I was saying before the intro, I came across your site. And for our listeners, it is, it's Trauma Treatment International, but the URL is tt-intl.org. I'll have that linked up here, the show notes page at the traumatherapistpodcast.com. But I came across it and I was like, wow, just super inspiring, sincerely, just super inspiring. I mean, this is what inspires me. So first of all, before we get into that, I just want to say I'm really excited to have you on here. Share with our listeners where you're from originally and where you are currently, and we'll dive in.
Sure. Well, I was born in Canada, so I'm a Canadian citizen, but I moved to the UK when I was 12 and lived in a mix of Scotland and London. And just before the pandemic, I moved to the seaside. So I'm just south of London now.
Awesome. All right. So, well, let's dive in here. How did you get here? How did you start? Why did you start this thing? Tell us that story.
Okay. I'm a clinical psychologist, and I've always been interested in trauma. One of the reasons I'm sure that will resonate with a lot of the listeners is the reason I like working in trauma is because people can recover from trauma. They can get better from the effects of trauma. So I find it difficult sometimes to work in places where perhaps a difference isn't as obvious. So I applaud people that can work with people with Alzheimer's, for example, but I can't do it.
What was that? Was that one of the initial impetuses for getting into psychology in the first place? Because you wanted to work for trauma, or what was that initial?
Yeah. So I've always had an interest in human rights and in politics, but generally from a human rights perspective. And so it struck me that working with people with PTSD, it specifically to begin with, would be a way of reaching the kinds of populations that I wanted to work with, the people that traditionally are not represented, do not have a voice, have been exploited, and so on. It takes a long time to train here as a clinical psychologist, same in the States. So, you do your degree, that's 4 years, then I did a master's, then I did a doctorate, and, by then it's almost time to retire, isn't it?
Right.
But I started off working with trauma and psychosis with people who had an overlap between the two, and then moved into we have the NHS here, the National Health Service, and we're lucky enough that many people, including asylum seekers and refugees, can get free NHS healthcare. And at the time, that included psychology support for people who were torture survivors. And I was really, really lucky to work in a place called the Traumatic Stress Clinic, which was a sort of a center of research and excellence in the UK and internationally, really, looking at how to develop, for example, trauma-focused CBT, I used to work with a guy called Professor Chris Bruin. He's got a theory called dual representation theory of PTSD, which really spoke to me. It really explains on a neurobiological level, as well as how to put it into therapy. So I worked with all these great people in a specialist refugee support team, and then went on and worked in another NHS place, and then left to work on a big war crimes investigation.
Okay, let me hold on here. So, first of all, incredible. I myself also had the opportunity to work in a clinic where there was trauma and early psychosis. So that was interesting.
Yeah.
But so you've had this incredible experience. What was it like working? Let's pick one of those experiences, working in that situation. What's it like working with people who've been tortured? I mean, I can't imagine.
It's humbling. It's difficult. There's such a big variety as well. Of course, everybody's different. The benefit of working with people who'd been tortured where I was is that they were safe. They'd escaped. So they were, in a sense, the lucky ones. However, before one of the services I worked in was set up, a lot of people had been untreated for years. So they'd been in London, but they'd not left their houses for 10 years. So they were really quite traumatized. But what I really like about it is the difference that can be made, and seeing people recover, going from somebody that hasn't left their house for 10 years to entering employment and enjoying it and connecting with people.
Were you a young clinician in that sense? Where were you on the trajectory of your professional experience at that time?
I was about mid in the National Health Service ranking for psychologists, I guess.
Okay. But in terms of your experience, how soon out of school were you at this point?
Well, when I left the doctorate program, I was lucky enough to work in this in an early intervention service for people with psychosis, and it was the trauma experience that I had that helped to do that. And I guess really what happened is we had the London bombings, where Al-Qaeda had placed a bomb on 3 metro trains, tube trains, and a bus. And the trauma clinic, which I was just about to work at, was about to be closed down. They lost all their funding. They were told they were going to be shut. Then the next day, the bombs went off, and they were all like, it was like Al-Qaeda saved this trauma clinic, right? And so there was a recruitment drive on, and I was, lucky enough to get a post there. And that's, I guess, you're just in the right place at the right time sometimes from a point of view. I was really, my colleagues were great. It was just such a wonderful place to work. Everyone was very passionate. There was such a variety of clients that were there. Yeah, I can't.
And of course,
about it.
It's one thing to want to work with trauma and work with people who've been impacted by trauma, and it's another thing to do the work. And what was that experience like for you personally, doing that work?
Well, initially, so I had worked in a similar trauma service as a trainee clinical psychologist, and I can very much remember my first day and the first torture survivors that I worked with. And it was overwhelming. The person that I first saw, this rarely happens, had only just escaped. He'd been tortured in Turkey. He was a Kurdish man. He'd been very severely tortured, and he'd literally pretty much just escaped. Because he had a political background, he was able kind of to get into the country fairly quickly. And he was so overwhelmed. And I guess my job at that stage, as somebody that, just doing their training, I'm thinking, I need to know more about Turkish politics. what is Kurdistan? Why the torture? What do I do with this guy who's literally curled up in a ball in my clinic, in the corner of the room? And I guess you just become human, don't you? You just sit next to somebody and comfort them to begin with. I think for the next 2 months, I probably had nightmares about war and torture to begin with.
Wow.
But I guess you become more used to it as time goes on.
How did things evolve such that you talk about the founding of Trauma Treatment International? Why did you start that? When did you start that?
Okay, so it kind of was started out of a frustration. Whilst I was working for the NHS, I was also working with different charities who work with torture survivors. Redress is one of them, Reprieve is another. And one of the things that Reprieve was doing was trying to get people out of Guantanamo Bay and get them released and highlight some of the very dubious, egregious human rights abuses there. Because I was doing that work, I also did expert witness reports. So a lot like Georgina King was talking about a couple of weeks ago. I listened to that great podcast. She seems lovely. I was doing a lot of that work, working with asylum seekers for lawyers, almost in the same way that she was. But I was also working with on some high-profile cases as well, that was included essentially lawsuits against the secret services, against MI6 and so on. And I think it's just one of those things, you kind of get a name for yourself. You do it once because nobody done it before, and then you're suddenly the go-to person.
Right.
I then got approached to work on a very large war crimes investigation of British soldiers who'd fought in either Afghanistan or Iraq. In fact, it was mainly the Iraq one that I was on. And there was a war crimes investigation that was initiated by the British government, by the Ministry of Defence. And I was only supposed to work with them for about a week. There were only a few cases. And I think I was there for about 3 years, something like that, 4 years, living in Istanbul half the time, flying back to London. And essentially, we saw 400 or so people who had fairly credible claims. But, the whole thing was a whitewash, in not just in my opinion, but in the opinion of the International Criminal Court. So it's in their opinion, there was a cover-up, and I certainly felt that there was. So very frustrated, because I have seen these human rights abuses, and most people in the military do not follow the rules, are compassionate. They themselves are placed at more risk if people are being tortured. So soldiers are more at risk. The population are being tortured and in some cases murdered. And there was a cover-up, in my, I guess it's about 20 years I've been working on these cases, and I've never really seen accountability. Mm-hmm. We're in a system where more money's spent on harming people than healing them, first of all. But accountability, I think, is important, which is what I thought I was helping to do. So get to the truth of something, not, of course, accept what everybody was saying as accurate, but a proper investigation, because I don't think accountability is a deterrent, but it does promote equality, stability, safety, protection, so that we all feel better. Mm-hmm. And yet, nobody in my 20 years has ever been held accountable for any of these. So I thought, what can I do to try to redress this? Everybody's just wasted their time. We've dragged these poor victims over to Istanbul, promising a criminal investigation. What can we do as psychologists? And that was the sort of drive to set up Trauma Treatment International.
So to create a space that demanded accountability, to protect individuals? Do both?
I mean, we're not an advocacy organization. There's lots of good advocacy organizations. There's lots of good organizations such as Human Rights Watch or many that are really working with traumatized people in order to stop this or pursue accountability.
Mm-hmm.
So my job isn't that, but I thought that as psychologists, as trauma-informed psychologists, we could help inform the organizations in how to best meet their charitable objectives, or if they're lawyers, to best do their job properly, if they're police, to best investigate it. And so the idea is, there's a certain amount of stressors that come with working with victims of trauma or working in these fairly high pressured environments. Like I felt when I just said about having the 2 months of nightmares, after seeing the person for the first time. And I thought we can use an evidence base to inform organizations in how they can work with their staff and with their beneficiaries. So either supporting the staff to do the work, or to help them to work with the people who have been directly affected by trauma. And of course, lots of the staff members are themselves affected by trauma. Lots of times I've been called in to just, give counseling to somebody, to help somebody who is burnt out. And I began to feel that this just isn't enough. What you need is management buy-in, really. You need organizational restructure, because it's the organization that supports people to do the work.
Mm-hmm.
So that was the first idea for this. And the second main aim of Trauma Treatment International is to promote evidence-based psychological therapy and to capacitate others around the world to be able to provide that. So the more people that we can train in various things that work, we're not married to one particular approach, the better. What we don't want to do is just be the ones that kind of fly in, provide some therapy and leave.
Mm-hmm.
Our projects, or our aim, is to go there, stay, set up a clinic or something like that, so that it is then standalone. We can leave. They have the skills and the resources to do so. That's the idea behind it, anyway. So run by local populations.
So, speaking with you, it's impossible not to feel or ask or become very existential about this, and just you're dealing with these horrendous crimes against humanity, against individuals.
Yeah,
right?
That's right.
What has this done? How has this shifted, impacted, influenced your view on what it means to be a human?
Yeah.
And I realize that's a crazy, heavy question, but you go.
I'll try and answer that in a couple of minutes. We see the dark side of life. We see the effects of trauma on people. Everybody knows that happens. Perhaps there's some denial. Of course, there's denial when Western governments are accused of it. We could never do that kind of thing. But most people can accept that happens. But the thing that really surprised me was just the lack of rules for very powerful organizations. The lack this accountability. As I say, it's not something that I want to pursue myself, but it's the idea that governments can go in, torture, rape, murder vast parts of the population, and there are virtually no consequences for it. And I kind of again, you think, well, this happens in other countries, but you can probably tell by the slight anger in my voice that I didn't think it would happen in the UK. I was naive. I thought that there would be a good investigation, and people would, if found guilty, be held accountable. And that isn't what happened, and that did surprise me. So I guess you're left with feeling slightly more unsafe. You always think that if something goes wrong, we can deal with it. And of course, in a lucky, privileged position. But yeah, the safety nets are not there in the way that I thought that they were. But at the same time, since the question is, what does it see about life? Well, you also see survivors. You see people who risked their life in order to change things for other people. You're working with colleagues who are just some of the most fantastic, lovely, wonderful people. And of course, there's more nice people than there are,
Right.
But equally, of course, more money is spent on the military than on getting people better. So it's a roller coaster, Guy.
Yeah.
I don't know what to say. You see the highs and lows of life.
Can you give us an example about how you work? An organization comes to you, or you're working with an organization and the staff is burnt out, whatever. Let's get a little specific on what you do.
Okay. If it's an organizational, rather than providing trauma therapy, if it's an organization, I'll select an organization that we worked with based in Kenya. They were a human rights organization. They were trying to promote human rights in an environment where they had little protection from the law, from the government. The trustees and people were in danger of arrest and arbitrary arrest. And they were also investigating a lot of disappearances. So people that were just plucked off the street and never seen again. We spent a couple of weeks working with them and understanding where some of the stressors come from. And I'll give you some examples which rather surprised me. And then we used what we know about how to help organizations to redress this. So this was a group of staff, first of all, that were working all hours, and they were expected to work all hours, and they were on call at any one time. But they were on call where they could suddenly just go to a murder scene, or they could suddenly go to a morgue. And the morgues in this particular bit, often ran out of power, so they were warm. I'm not going to go in, horrific environments. People would see, terrible things. And those people were also becoming more and more disconnected from their families because they were working all of the time. And, where they were, it takes hours to get in because the traffic is at a standstill. And, there wasn't supervision structure. So people had nowhere to take their feelings, nowhere to take the emotions. So we helped them to set up a system of supervision. We made a series of recommendations that included essentially taking holidays and breaks and all of the normal things. But there was a culture, because people were so passionate, there was a culture of, I can't possibly, take a holiday, or I'll be frowned upon by my colleagues. And really, the leadership has to come from the top for this. If the CEO isn't taking holidays, nobody's going to take a holiday. Mm-hmm. So we worked with this organization just to put in some fairly basic structures to reduce, but also to help to have a place that staff could take some of the things that they'd seen, a sort of a counseling service, sort of a clinical supervision style approach there. That's one example.
Right. Listening to you talk about the way they were working, I'm almost surprised. Did they reach out to you and say, we need help, or?
Yeah, sort of. So I had worked with these various organizations just as an individual over the years. And I could, and in doing so, and working with other organizations just as Brock Chisolm, clinical psychologist kind of thing, I saw that there was a big need for organizational support or for training people to do more effective therapy, basically. And so I had the contacts because of the work I had been doing with other people over those years. And when we raised some money, contacted a few organizations, and it got the ball rolling there. But, you know, we're still a very young charity. We've been going 4 or 5 years, but it turns out setting up a not-for-profit is a lot more difficult and time-consuming than I thought. I knew it would be hard. I then became burnt out, ironically. I didn't follow my own advice. I am now. And yeah, we're at a new chapter with a wonderful new CEO, and things are now taking off. We have a team behind us. Yeah.
So you founded this with whom?
So I founded this with 2 other people, Dr. Katie Robgent, who was a friend. So I came up with this idea and then approached a couple of other people that I knew saying, hey guys, I got this idea, what do you think? And they went, that's insane. Yes, let's do it. Katie is well known for, she's worked in the DRC and all over the world in refugee camps and so on, using narrative exposure therapy. And also Polly Rossdale, who at the time had been working for Reprieve, an organization I mentioned earlier. And Polly and I had worked on cases. We had set up, mainly Reprieve, had set up a trauma clinic in Tunisia for people who had been in Guantanamo Bay. So they'd been in Guantanamo Bay and they were returned to Tunisia, and we were sort of setting this up. And that gave us the idea, hey, let's try and repeat this model.
Yeah. You said narrative exposure therapy.
Yeah, NET. Are you familiar with that?
I am not, but I would like to learn about that.
It's a little bit like CBT, although anybody who does NET would shoot me for saying that. But I think it is. Katie would disagree. And what's great is it's designed in Germany. Has a big evidence base of working around the world. And essentially, it's a kind of story-based exposure. So it's like prolonged exposure, like reliving in trauma-focused CBT or CPT, but it's much more about the narrative. And the good thing about it is that you can train people with no psychology expertise whatsoever or experience. So you can train lay people to deliver it. Yeah.
Okay.
Big advocate of that. I think that's going to help the world.
In terms of trauma treatment modalities, what's been your education? What do you find is working with the population you're working with?
So, you know, I started off working on an individual basis, on a one-to-one basis, with people who specifically had PTSD. So it wasn't trauma, I mean, after working with people with psychosis, but in the trauma service. And, you know, trauma counts for about 50% of all the psychiatric diagnoses. In other words, if there's no trauma in the world, there'd be 50% of people not having a diagnosis of any kind. But this was very specifically PTSD. And because of the clinic I was in, it was cognitive behavioral therapy, and then that we used, and also EMDR, because that's what had the evidence base. Since then, of course, you know, the majority of people who go through a traumatic event don't develop PTSD, but that doesn't mean that people are unaffected. Right. So then it's really the evidence base is about starting social groups, connecting people, getting people out and doing things, you know, becoming human again, finding themselves.
What, you know, you earlier on, you talked about, you know, being a human. Can you share with us an early clinical error?
It suddenly froze there, Guy. What
Oh,
did you
yeah.
say?
Yeah. Early on, you talked about, the importance of being human. And I was wondering if
Yeah.
you can share with us an early clinical error that you, uh,
Error.
yeah, had the fortune of
Wow.
making.
Yes, there's lots. Now, um, I I don't know whether to talk generally or specifically.
No,
I
let's get
think
specific.
that specifically, I'll tell you something rather surprising on my last day of work at the trauma psychosis uh, thing that happened. I'll just, I don't know if it's an error, but well, let me just tell you what happened, and you can decide.
Okay.
So I was working with a man who had a sort of early onset psychotic symptoms, and he believed that he was part of, he possibly believed that he was part of Al-Qaeda, and he had sympathies with terrorism, he thought, but it was part of a delusion. I'm getting there for the, I'm going to explain what happened here. Now, Hindu background, not religious, doesn't understand anything to do with Islam. It wasn't that he was drawn towards like people who I've since worked with, but he wasn't really drawn towards terrorism. He had a delusion that perhaps he was in Al-Qaeda, which he was not, if that makes sense. And he had to get back to university. He was getting much, much better. He had to get back to university, but the London bombings, the bombs had gone off recently, and ironically, that made him frightened to travel. So I thought, this is my last day of work, pretty much, before I start at the traumatic stress clinic. And I thought, well, we'll just do some exposure. We'll go onto the tubes. We'll see that it's okay. We'll get the metro into the center of London. Well, I can't remember if it was a week or 2 weeks after the bombings, but essentially there was a second lot of bombers.
Oh my.
Yeah, no, nobody was harmed in the second lot of bombers. The other thing that happened is that there was a big memorial service. At one of the bombs, and the bus went off outside of a big medical institution, which timing-wise wasn't a bad place for that to happen. The bomb went off, so there was a big memorial service in this place, and that happened to be just near where he was going to university. So we turn up, and I don't know that there's this memorial service. They see a boy with brown skin. The world's press are there. They all think that he's coming to the memorial service. We're actually just walking past.
Mm-hmm.
Suddenly, he's got the cameras thrust on him. I'm thinking, oh God, what's he going to say? And, he was perfectly appropriate. He was absolutely fine. I was a nervous wreck because I didn't know what was going to happen. Weirdly, they thought that we were invited. We get ushered into a place that we had no business being. We weren't invited to this. And then we got out. And then, as I say, these second potential bombs had gone off. So we had to walk 2 hours back through London home. What did I learn from that? I learned that you just can't expect anything. Mm-hmm. I was told it was a mistake to have gone in there, and I think it probably was. However, yeah, he did reconnect with university. So that's not that didn't really answer your question, did it? I feel like I'm hiding an error now because I can think of so many.
Well, no, I think there's a lot in there that people can, take from and learn. I mean, I appreciate you sharing that. The work you're doing, I mean, it sounds, you talked about the 2 months of nightmares and stuff. How do you take care of yourself doing this stuff?
Well, as I say, for a little while I didn't, and I did become burnt out. And the the key, I think, for caring for you. The most important thing is social relationships and having good quality people around you who you can offload or just socialize with. Once I become more and more burnt out, you work more and more and you cut yourself off until actually you don't realize the impact. So I guess the other thing is having other people around you to say, hey, take a break, do something else. And then it's just the simple stuff, isn't it? Exercise, eating well,
actually doing it.
Actually doing it,
right.
Yeah, which I was not.
Right.
Yeah, actually doing it.
People are going to be listening to this, Brock, and therapists, survivors, combination of the two. Who do you work with? I mean, you talked about organizations, and but are there people listening to this that might be interested in working with you, or do you offer teachings or what?
Sure. Yeah. So we at the moment have an associate model where we're looking for people who would like to work with us on various projects, and to sort of have a bank of people who are trauma informed to do various different projects. And anybody who wants to get in touch, first of all, go to our website, sign up for the newsletter. As you said that you put the URL on there, but email us at info@tt-intl.org if you'd like to be interested to become an associate.
But in what capacity would they be working? What would they be doing?
So the answer is partly we don't know, because we don't know where people are, but we're getting together. First of all, everybody would be offered training so that they understand the aims and objectives of Trauma Treatment International, but also our approach to therapy or our approach to organizational assessment. So they get training. And then depending on where people are would depend on the projects that we're doing. So at the moment, the projects that we have, we are starting a service in northern Iraq, in Kurdistan, for the Christian community that were abducted by ISIS as young boys. So that's one possibility. We're also working by providing direct treatment to female Afghan judges and lawyers that have escaped the Taliban recently and are at various places around the world. We're doing that online.
Wow.
So I don't know what we'd be doing.
But fascinating. And I think what a great opportunity for people to learn and get this incredible experience. Look, Brock, super fascinating talking to you and really inspiring. And I just want to say thank you for doing the incredible work you're doing. Blown away by what you've put together and what you're doing.
Thanks, Guy. I really appreciate you contacting us.
Yeah, I'd love to keep in touch. Love to have you back. And just you are doing it, man. And it's so inspiring. Sincerely.
Thank you. I really appreciate your time as well. Your website's great. I've just been listening to all the podcasts going, wow, there's hours of this stuff. This is excellent.
I appreciate it. Well, let's keep in touch.
Okay. Cheers.
All right, man. Take care.
Bye.
Thank you so much for listening and supporting this podcast. And if you'd like to join the hundreds of other therapists who are each month keeping up to date and informed and inspired about what's going on in the world of trauma, I'd love to invite you to head on over to the Trauma Therapist newsletter. That's the traumatherapistnewsletter.com.